Hi everyone, Dr. Jeff here with you again this week with Meghan. It's coming up to Valentine's Day, so happy Valentine's Day everybody. It's also a new Lunar New Year for the Asian community, so happy holidays. It's also February, which means it's Heart and Stroke Month, so I thought we'd take the time today to review some of the signs and symptoms of heart attack and stroke. So Meghan, what about stroke? What are some signs of stroke?
Yeah, so for stroke, you might have heard of the acronym FAST before, which helps us remember the signs and symptoms. The first letter is F, which stands for face. Someone may experience a drooping in one side of their face or numbness.
And A stands for arm. So if you get someone to try and lift their arms up, you're going to find a weakness in one arm. You might also find some numbness going down one arm or the other.
S stands for speech. Someone may have confused or slurred speech.
And T stands for time, and time is of the essence. It's very important you get to the hospital as fast as you can. If you're suffering a stroke, and then get the anti-clogging drugs into you to try and limit the damage caused by a stroke. So if you have any of these signs at all, it's very important you call 911 and get to the hospital as fast as possible.
Some other smaller symptoms that you might experience is troubles with balance, headaches, or vision.
That's cool. How about heart attacks, Meghan? What are some signs of heart attacks?
Yeah, so for one, this time of the year, it's cold outside, and if people are going outside and they're shoveling or they're exercising, the cold air can actually constrict the blood vessels around the heart, and if somebody has a pre-existing problem with the heart, they could be prone to heart attacks in the wintertime. So starting for men, a typical symptom is having pressure on the chest, feeling like somebody's sitting on the chest. That can radiate up the neck, into the jaw, or down in the shoulder and down the arm. Typically it is in the left arm, but sometimes it can be in the right. And along with this, people typically have a sense of shortness of breath.
And chiropractically, as a nerve is concerned, the nerve that goes to the heart is around the forethoracic, which is kind of up between the shoulder blades, and that's an area that can get very, very tight. For some people, that's almost like a precursor for having a heart attack. The other thing people might feel is some heartburn. And this is kind of an angina type of pain. As Meghan was mentioning, the vessels around the heart, if they get cold, you breathe in cold air, it can get constricted. And they get this feeling of a heartburn. And if they take some nitroglycerin, that kind of goes away. Other things men may feel is that they get like a cold sweat, fatigue, or faint. Feel almost like they've got a little bit of the flu and they need to go lie down. Women are a little different. Women may not get that feeling of that pressure on the chest, where it feels like somebody's sitting on the chest. They may feel it more in the abdomen. They'll still get some shortness of breath, but they'll just get some severe fatigue, so they feel they have to go lie down and have a nap. So women may be a little different than men when it comes to the signs of having a heart attack, but no matter what, it's important you get to the hospital as fast as possible. The one thing you want to watch out for is something called denial. And that's that you're denying that anything's happening to you. That you think maybe I just got rid of the flu, or I'm just not feeling well, I need to go lie down. It's better to go to the hospital and find out you're not having a heart attack or a stroke than to get there too late, because by then the damage is done. So if you have any of these signs or symptoms at all, get to the hospital, get them to check it out for you. So as always, if you have any questions about anything we talked about today, you can always email us at jgoldsworthy@goldsworthywellness.com, or you can talk to us on Facebook. If any other questions out there that you are interested in having us answer for you, you can always send them to me. And as always, I'm Dr. Jeff, I'm here with Meghan, and we've got your back.